Okay. Hi, everyone. I'm Aishwarya. I am a pelvic floor physical therapist from Pennsylvania. Thank you so much for joining us today. We're going to talk a little bit about what's really the pelvic floor, what goes into making the pelvic floor, and how we can work around some of the most common things that we see when our pelvic floor is not doing what it's supposed to be doing. I am here with Virtual Care with a K today. We provide customized disease-specific group and individual sessions by physical therapists, occupational therapists, and speech therapists. Let's dive right into what exactly is the pelvic floor, where is it, what does it do? So pelvic floor muscles, as you see on the screen, is that red layer of muscles. It almost looks like a sling or a hammock, and it spans from the front of the body to the back, and it also spans from one side to the other. So it's literally like a sling where a lot of our organs are kind of resting. So the picture on the left is for men, where you have the bladder, the bowel, and then in the back you have the spine, and the pelvic floor muscles kind of like support the bottom there. Just under the bladder, what you see is the prostrate gland. In some future presentations, we can get further into how pelvic floor muscle training can be helpful for some people who may have some prostrate related problems. But going on to the right side, in women, the pelvic floor muscles again spans from the front to the back, and it supports, it's kind of the bladder, the uterus, the bowel, and the spine in that way, are all kind of like supported on this layer of muscles. Pelvic floor muscles can be like any other skeletal muscles in your body. So like we have neck muscle, we have biceps. Pelvic floor muscles are pretty similar structurally. However, their function can vary a little bit, which is what we're going to talk about majorly today. I also like to introduce this canister concept, where we are almost looking at the body as a canister. So your diaphragm, which is your breathing muscle, rests on top. Your pelvic floor muscles from the bottom of this canister. And then you have your abdominal muscles in the front and your back muscles in the back. So how we manage the pressure within this system is really one of the things that help the pelvic floor muscles function and do what they're supposed to do. Majorly, we'll be discussing two things today: that support that we're talking about for all these organs to rest on that pelvic floor, and how these pelvic floor muscles can help us control the urine and the bowel contents from if to prevent like any incontinence or involuntary leakage of either urine or the bowel contents. So just to summarize this slide, when we breathe in, your diaphragm goes up, and that's when your pelvic floor muscles relax. When we breathe out, your diaphragm kind of comes down, and that's when your pelvic floor muscles activate. So if at any point we're holding our breath and there is that increase in intra-abdominal pressure, if these muscles are trained well, they should be activating to kind of equalize the pressure within the system. And so whenever we work on pelvic floor muscle training, breathing can be a really important part of that whole system. This is just a cross-sectional way of looking at the pelvic floor muscles. So I just wanted to show that the pelvic floor muscle spans from top to bottom and then from side to side. So all this layer in the bottom is covered by muscles that's called our pelvic floor muscles. Always like to start with what's normal. So then we can like go ahead and talk about, okay, like why am I having all these issues if the pelvic floor is not functioning well? So with respect to the bladder, as you can see on the picture on your extreme left, The bladder is kind of like a muscle. When the bladder contracts and your pelvic floor muscle relaxes, that's when we urinate. So in other words, your pelvic floor muscles kind of have to have a little bit of a hold for your bladder to not just lose the control of urine. So generally, the bladder is more relaxed and your pelvic floor muscles kind of hold the bladder up. So then there is not that constant leakage of urine. So when we actually have to urinate, what needs to happen is your pelvic floor muscles, your bladder should contract and your pelvic floor muscles should relax for the urine to come out. It should be a pretty passive process. We shouldn't necessarily be pushing or straining to get the urine out. And typically it takes about 3 hours for the bladder to fill. That stream should be at least 8 to 10 seconds long. So sometimes if you're not sure if your stream is normal, is it too short, is it too long, couple times a day you could even count. So go 1,000, 2, 1,000, 3, 1,000, and just see how long is the stream of urine. Typically, we should void 4 to 6 times a day, and the interval can be between 2 and 4 hours. This, I'm assuming, is for somebody who's not taking any water pills or Lasix or any other medications that may be making them go more often. So this, I'm all talking about in a normal person where they're not on any specific medications. This is kind of what's expected. You could be going to the restroom 1 to 2 times a night. Again, there's some variations with aging. So the younger we are, we should be able to not use the restroom at all at night. And then the older we get, there's some changes that happens with the pelvic floor muscles and the prostrate gland. So we may be going 1 to 2 times a night. One of the things also that's recommended is to avoid voiding just in case. So a classic example of this would be, oh, I need to run out to the store, let me just go void. If it's not been that long since your last void, you want to almost wait for your bladder to tell you that it's time to urinate rather than forcing your bladder to urinate when it's appropriate for us. Urinary urgency, which is that strong sensation of feeling like I really need to urinate right now. I'm going to talk in more detail about it. But one of the things that may be happening in your system is it's not getting enough fluid. So if you don't have enough fluid to keep your bladder happy or hydrated, the urine can be more concentrated, and that itself could give you a sense of urgency. So these are some things that we want to remember. It should take a little while for our bladder to fill. The stream should be a little long, and we should have more voids during the day so we can rest well at night. And typically you want to avoid drinking a whole bunch of water right before you go to bed, because obviously that's going to keep you up at night. I like to kind of distinguish pelvic floor muscle problems into two main categories, and by no means this is a exhaustive list of everything that can be going wrong, but I'm just trying to make it really simple for this presentation. Either there can be overactivity, which means your muscles are not relaxing very well and they're kind of too tight, or there's weakness and the muscles are not tightening very well, and that's called underactivity. So too much activity, too little of activity would be the two main broad categories that we would classify pelvic floor muscle problems into. So since we spoke about the normal, Now let's kind of circle back and really talk about what problems can we expect from these muscles not doing what they're supposed to be doing. So one is urinary urgency. Like I said, that strong sensation that the bladder gives you that you need to urinate right now is called urinary urgency. And again, one of the reasons why you could be having urinary urgency, among other things, could be we're not getting enough water. So really looking at the color of the urine, it should be pale yellow to almost whitish. If it's going more in the darker side, then that's an indication that we're not getting enough fluid, hydration, water into the system. Frequency. So not so many times I will have patients and clients come and tell me, I feel like I need to go to the restroom every 20 minutes. So going back to that previous slide, we want to try to get the interval between 2 episodes of urination at least to 2 hours. It can be even up to like 4 hours, just really depends on where you're in that age and physiologically what your bladder is doing. But too frequent, like if you feel you're going to the restroom every 20 minutes, then that's something we need to make sure we're talking to our providers and bringing it to their awareness, because there is help that we could provide to help in this case. And I'll talk about some of the very simple things that we can do today. Incontinence is basically involuntary leakage. It can either be associated with urine, or you could have incontinence associated with the bowel. So if we went to that first picture, like I said, it supports the muscles from the front all the way to the back. So obviously these muscles help the bladder, but they can also help the bowel. And then you can have incontinence because these muscles are not doing what they're supposed to be doing. And I just want to make a quick note here. When I speak about incontinence, generally people assume it has to be that they empty the entire bladder involuntary. Even a few drops, or even if a couple times a week you feel a little leakage, it's still considered incontinence. It's just not a very severe form of incontinence, but that can still be improved, and we can work on certain things to have that minimized and almost eliminated if the situation is permissible to getting pelvic floor physical therapy. Pelvic pain can be a whole another thing that we can talk about in the future. I just wanted to mention that here, if your muscles are overactive and they're not able to relax well, that could be one reason why you're having pelvic pain, amongst a bunch of other things that can be going on. Constipation is really common. So again, constipation, we're going to talk about that in the future. I'm going to do another presentation, but just real quick here, if your muscles are not able to relax, that can be one of the reasons why you're having constipation, among diet and fluid and fiber and other things that we can consider going on in the system also. So in summary, you want to take a look at your water intake. You want to make sure you don't have any irritants in your system that may be bothering the bladder. Not everybody, but some people respond to citrus juices and they could have more frequency with that. For some people, caffeine can be a trigger. For some people, alcohol can be a trigger. So really we need to kind of like see individualized what seems to bother your bladder. And there's a lot of resources online where you could look at bladder irritants, but I always like to caution and say it has to be a more individual approach on what bothers your bladder, and kind of we go down that route. If you're having low back pain, hip pain, weakness in your hip, and it's been going on for a long time, and associated with that you're having any urinary or bowel problems, it's very likely that your pelvic floor muscles could be part of this situation. Your pelvic floor muscles, like they form that sling, they also attach, some of the fibers attached to the back, some of the fibers attached to the hip. So if we have a situation where you've had a long history of low back pain or hip pain that's not gotten better, it's worthwhile to address and look into the pelvic floor and see if that's one of the sources still contributing to your symptoms. So I definitely recommend seeing a therapist who specializes in pelvic floor physical therapy. I will just provide some general information today, but that doesn't replace or you could completely eliminate seeing a therapist, because what you need for your body should almost be a customized and individualized approach that you need to be taking to address your particular issues. Okay, so some quick things that I would just like to mention would be, so if you're having that urinary urgency, you could work on some quick contraction and relaxation of the pelvic floor muscles. They're also called your Kegel muscles. And so what that would look like is you take a deep breath in through the nose, breathe out from the mouth, and you're going to feel your pelvic floor muscles, which are right at the bottom. So if you're sitting, you should feel those muscles right where your bottom hits the chair that you're sitting on. So you could do some quick squeeze and release of those muscles, which can help connect the bladder and the pelvic floor muscles. It helps them talk to each other a little better. Doing some breathing, especially diaphragmatic breathing, can be really helpful because it activates part of the nervous system that helps kind of calm things back down for us. So it can create that brain bladder connection. Again, looking into individualized food triggers that you may be having can be really helpful. So there's a lot of options online about filling a bladder diary, filling a bowel diary, just to see it in black and white. If we're seeing any particular food or liquids are irritating the bladder and we're having those symptoms. A general advice would be to reduce your water intake towards the evening, so that way you're going to bed with the bladder not being too full. And again, if you're having medications at night and you have some special medical conditions, this doesn't really apply to you. So definitely talk to your physician and see if your medication timings can be switched. Again, all of that doesn't come from us, but that's a conversation that you can definitely go back and have with your provider. So in summary, a couple things that we can start off with would be, again, that belly breathing. So you want to try to get your belly working more than your chest. So you're breathing in through the nose and breathing out from the mouth. And you could just practice that sitting, watching TV, doing things around the house, just reminding ourselves to take those nice breaths where your diaphragm, your pelvic floor can kind of like manage that intra-abdominal pressure better, can be really helpful. So breathing in through the nose, feeling that little rise in the belly, and then breathing out from the mouth. Using a step stool. So many people have already heard about squatty potty. Basically, it's to get your knees higher than your hips when you're particularly having a bowel movement, but it can also really help empty the bladder completely, because when your knees are higher than your hips, it actually helps relax certain pelvic floor muscles. So it's going to be easier for you to have a bowel movement and also urinate. One of the other things that I highly recommend is to not hover. So we want to really sit on the toilet bowl and not hover, because with hovering, your pelvic floor muscles are not going to relax all the way. So if we want to sit and we want to get your knees higher than your hips, as you see on that picture, that's going to really help relax those bottom muscles. So everything that needs to come out has like a path to do that, and in an easier way, and you're not straining. And the quick contractions can really help with the urgency too. So if you're feeling urgency before you get up and walk to the restroom, just taking a couple seconds to do some quick contractions can really help relax the bladder, so we make it to the restroom and we're not having leakage on our way. Especially more so with elderly folks who have some balance issues. When they're trying to rush to the restroom, that may be one of the times where they're really at an increased risk for falls. So some of the simple techniques can be really helpful to minimize the risk for falls. So I just wanted to go over a couple repetitions of the breathing and coordination of the pelvic floor muscles. And like I said in the beginning already, we want to make sure if you're having some of these issues, you do see a provider. So you're making sure you're activating the right muscles and it's working for you. But I just wanted to kind of like summarize and show how these systems work together. So when we breathe in, remember the diaphragm goes up, your pelvic floor muscles relax. So if you want to do an activation of the muscle, or you want to do that Kegel contraction, for women, you can think about stopping the flow of gas or urine. And for men, you can think about pulling the penis back. So it's going to be breathing in, breathing out. Tighten those bottom muscles. So you should just really feel it where you're sitting. It shouldn't be holding your breath or squeezing your butt or any of the other muscles. So you're going to breathe in, you're going to breathe out. You can tighten those muscles, hold for about 5 to 10 seconds. And then you're going to go ahead and relax those muscles. So I just wanted to practice that a couple times so we can kind of get a hang of this. So breathing in through the nose, breathing out from the mouth, and then you're going to tighten. Hold 2, 3, 4, 5, and then release. Okay, breathing in, breathing out, tighten, hold 2, 3, 4, 5, and then release. Great. Breathing in, breathing out, and tightening. Hold 2, 3, 4, 5, and then you can release. So again, how many reps of this we should be doing, and all that should be based on a more individualized approach. So I would highly recommend, if any of this symptom seems like you could be having these issues, to make an appointment to see somebody personally. But the whole idea of today's presentation was to bring some awareness into these bunch of muscles, which can be really, if they're trained correctly, can be really helpful to address some of those problems. Really appreciate your time today. Thank you for joining us, and keep a lookout at future presentations that we'll be doing to address some of the other concerns that I briefly mentioned today. Again, thank you so much for your time. We really appreciate it.